Hi, my name is Bruno Silva. I'm one of the dentists at Brighton Implant Clinic, and today in this video blog we're going to be talking about sedation. I'm going to go through some questions and answers about what sedation involves, how it can help you to reduce anxiety and make going to a dentist a lot more pleasant. Unfortunately, in our daily practice we see a lot of patients that are very anxious about seeing the dentist. They'd rather be somewhere else and they would rather not come and see the dentist. The truth is that quite often if you're delaying having a dental procedure carried out, the problems become much more profound, and eventually you have a problem that really has to be addressed by a dentist or the dental team. Essentially, it's a technique that is used by the dental team to help reduce anxiety at the dentist. It can be either by taking some medication orally, so you can take some medicines the day of treatment or the day before, or it can be by means of inhalation. A gas called nitrous oxide is used, or like sleeping gas, to basically help you to become more relaxed at the dental practice. The most common type of sedation that we use here at the clinic is called intravenous sedation, and that's basically where a small tube is introduced into your bloodstream and the dentist will be administering a small quantity of sedative to help you feel more relaxed. Sedation is used for general dentistry, for preventative dentistry. Most commonly here at the practice, sedation is used for dental implants and restoring missing teeth that patients have with fixed dental implants and crowns and bridges. Some common questions that patients will ask us about sedation, some of those are, is it safe? Yes, it's very, very safe. We carry out many procedures that use sedation. Sedation basically helps to make those procedures actually safer. Patients are more relaxed. The dental practitioner can carry out the procedure with the patient being a lot more cooperative with the treatment. Essentially, that will increase the success rate of the procedure. So it's very, very safe. Quite often patients will ask us if they're going to feel nauseous after having sedation. The answer is actually no. It's very, very comfortable. The patients feel very pleasant, and the effect of feeling nausea after anesthesia is quite commonly associated with general anesthesia. And on the note of general anesthesia, a very common question is patients asking us if sedation is the same as general anesthetic. Okay, so general anesthesia has to be carried out in a hospital setting. There'll be a team of doctors and nurses to basically provide general anesthetic, and as a patient you're actually dependent on machines to help you breathe and to monitor your reflexes and responses. So it's a lot more profound, and it's not carried out in a dental practice setting. It's very important to avoid eating for 3 hours before having sedative. This just makes the whole process a lot safer. In the event that you did feel unwell during the sedation, that wouldn't basically cause further problems with you feeling unwell during the procedure. So it's very, very important to not eat before having sedative. Another question which is quite commonly asked is, will I feel any pain when I have a sedative? And the truth is that what actually happens with having sedation, you're going to be still having a local anesthetic to basically numb the pain, and the local anesthetic just becomes a lot more easier to administer when patients are already slightly asleep, they're in the twilight zone. It makes them feel a lot more relaxed when having local anesthetic administered. So yes, you won't feel any pain, but that's mainly down to the fact that local anesthesia is still used. The intravenous sedation, it just reduces your perception of feeling discomfort. You can still communicate with the dentist, you can still tell the dentist that you're feeling pressure or that you're feeling unwell, although that you will be a lot more relaxed, more unconcerned about what's actually going on, which is actually very good because it just means that the procedure can be carried out with greater cooperation from the patient, which, as I said earlier, increases the success rate of the procedure. One of the advantages of having sedation is that actually you will have some degree of amnesia afterwards. This is a positive side effect because some of these procedures patients generally would want to not remember or don't recall what's actually happened during the appointment. At all times, the dentist is accompanied with the dental team, so it's a very safe procedure, and as I said earlier, we're experienced and trained to be carrying out this procedure routinely within our dental practice. There are some considerations though. In some cases, the sedation that the dentist is administering may not be effective or profound enough, and this can be due to some pre-existing medication or also the use of recreational drugs. It can reduce the effectiveness of sedation. It's something that we highly recommend, really only for those patients that are anxious about seeing the dentist. All of our dentists, we try really hard to make sure that we don't cause any discomfort to patients when having any procedure. Quite often patients that actually start their treatment journey having sedation, but then each appointment that goes by they feel more comfortable with the dentist. They progress to having treatment just with local anaesthetic, and then all the treatment generally after that is under local anaesthetic, and they become very compliant, very good, very relaxed patients at the practice. So I hope this video is helpful. If you did have any questions, please feel free to send us a message. You can call us, all our numbers are toll free, and we'd love to welcome you to any one of our clinics. So that's the topic for today, and I hope you enjoyed the video, and we'll see you again soon. Thank you very much.